HIV and AIDS in South Africa and the United States. Toward the end of the 20th century, the world was introduced to one of the worst pandemics imaginable. There are currently 1.2 million people in the United States and approximately 5.6 million people in Southern Africa living with HIV or AIDS. Human immunodeficiency virus leaves its host unable to fight opportunistic diseases, often leading to death. A better perspective of HIV or AIDS can be obtained by examining how it's spread and treated, as well as how it's being made under control in the United States while out of control in Southern Africa. Human immunodeficiency virus is a deadly virus that attacks the immune system and weakens its ability to fight infections. In its late stages, HIV develops into the symptomatic period known as acquired immune deficiency syndrome, or AIDS. HIV weakens the immune system by attacking specific white blood cells called CD4 plus T helper cells. HIV is transmitted person to person through blood or other bodily fluids, through activities such as unprotected sex, needle sharing, or breastfeeding from infected individuals. It is believed that HIV originated from the transmission of SIV, or simian immunodeficiency virus, from chimpanzees to humans in southeastern Cameroon in the early 20th century. The first known cases in the U.S. reported in the 1980s in Los Angeles among homosexual men. The disease was categorized at first to be limited to the Haitian and homosexual communities, but the increase in cases among the public proved that it could be transmitted to anyone who is exposed to infected bodily fluids. People who are infected with HIV or AIDS become susceptible to many diseases and illnesses that do not usually affect healthy individuals, such as the rare infection pneumocystis pneumonia. Early symptoms of HIV are usually mild and flu-like, such as vomiting, nausea, and diarrhea, but symptoms then may not appear again for 2 to 15 years after the initial symptoms. The symptomatic period is characterized by swollen lymph nodes, weight loss, fever, and diarrhea. Without treatment, patients can contract a number of serious illnesses and cancers due to their weakened immune system. There is no cure for HIV, but there are a few drugs available to slow or suppress the progression of both HIV and AIDS, like the adherence to a retroviral therapy regimen. The first and main drug used today is called AZT, which is given to pregnant mothers who are HIV positive to help prevent transmission to the child. About 35 million people are currently living with HIV worldwide, with 1.2 million of those people living in the United States. In 2010, it was found that in the 5 countries leading in adult prevalence worldwide, HIV was responsible for 41 to 56% of the deaths, proving that HIV infection rates are not decreasing. In 2007, an estimated 1,000 children were born with HIV every day, due in part to the lack of access to prevention of mother-to-child transmission.
Although the majority of the world has seen a steady decline in the number of deaths in those affected with HIV, South Africa has seen an increase from 3.9 million in 1999 to 5.6 million in 2012. In order to understand the spread of AIDS in South Africa and its surrounding countries, culture and sexuality, socioeconomic factors, and medical and educational availability regarding AIDS must be considered. Culture largely contributes to the spread of HIV. In the most poor and uneducated areas in southern Africa, a belief in witchcraft disables inhabitants from having the knowledge to prevent HIV because they blame uncontrollable sources to be the cause of the disease rather than their own actions. In the witchcraft-practicing southern African country of Namibia, both men and women believe masculinity and the ability to pass on children to be the most essential goals in life, with polygamy and approval of many sexual partners by men encouraged. An estimated 21.3% of Namibians 15 to 29 years old are infected with HIV. Cultural beliefs in other male-dominating societies like Botswana force women to provide sex for male recreation. One belief is that having sex with a young girl cleanses a man's reproductive system, including the HIV virus. In a socio-economic context, poverty plays a role in the spread of HIV in southern Africa. In spite of the hostility towards sex workers, commercial sex is a thriving industry. Living conditions in Botswana, Zimbabwe, and South Africa have forced many men and women to engage in sex work. These workers have an average of 20 customers a week and admit to using condoms only 10% of the time because most clients refuse its use despite the availability of free condoms in South Africa. A lack of healthcare workers due to low salary and poor working conditions has caused the number of HIV cases to rise in southern Africa, with nurses in such areas such as Malawi treating as many as 400 patients per day and receiving $3 for the day. An estimated 70% of patients needing treatment are unable to receive it. Although heterosexual intercourse is the leading cause of the spread of HIV in South Africa, the sharing of needles by drug users in Cape Town, which is growing in the practices of illegal drug trade, is a major area of concern. High costs of clean needles and treatment, along with the long lines and waiting lists for treatment, staff negativity and unconfidentiality, and lack of public awareness through education were reported by users as potential problems for solving the crisis. In areas of high poverty in South Africa, unavailability of readily accessible information concerning the disease helps contribute to the spread of the epidemic.
Despite the many factors contributing to the rise of HIV and AIDS in Southern Africa, there have been programs implemented to encourage decline. The Department of Health and Education in South Africa has developed a life skills course for grades 8 through 12 in order to introduce them to the precautions that should be taken in AIDS prevention. And in 2003, a national HIV and AIDS treatment program was started to extend free treatment to those in need. However, because South Africa's national registration database that tracks deaths from HIV and AIDS has been grossly underreported since 1996 and is constantly under scrutiny, whether or not these programs have been successful is difficult to quantify. In comparison, the United States has significantly lower rates of HIV than those of South Africa. However, while America may be more technologically and medically advanced than other countries like South Africa, HIV is still a very prominent disease. In North America alone, 1.3 million individuals are living with HIV. In a world of increasing stigmas regarding medical diagnosis, people diagnosed with HIV will more than likely not speak up about it. Therefore, there is a need to prioritize and target HIV prevention efforts in communities that are disproportionately affected compared to others. One study found that poverty was a key factor associated with HIV infection among inner-city heterosexuals. Living in poverty limits someone's ability to seek the necessary medications and medical procedures needed to treat or slow this disease down. Male homosexual relations and injecting drug use remain prominent factors in the HIV epidemic in the United States, with an estimated number of 40,000 people that have been infected each year in the last 10 years. AIDS specialists in Tennessee say that college students account for the greatest influx of young people they treat, and it's mainly due to the misinformation and ignorance about their risk for contracting this disease. The number of newly infected people would greatly decline with increased awareness and prevention education among young people, and would help to promote shared responsibility for prevention of HIV transmission.
Though the majority of people living with HIV are men who have sex with men, HIV has grown to affect greater numbers of African Americans and women. AIDS is among the top 3 causes of death for African American men aged 25 to 54, and for African American women aged 35 to 44, with African American women who account up to 72% of the new HIV diagnosis in all the U.S. women. As HIV has continued growing into a major concern for the world, the government has begun to shift its focus to improving the HIV infection rates and care for those living with the infection. On July 13, 2010, the Obama administration released the National HIV/AIDS Strategy that focuses on 3 areas: reducing new infections, improving access to care and health outcomes, and reducing HIV-related disparities. People living with HIV aren't only affected physically by the virus. Their health as a whole is prone to decline from the effects of being HIV positive and learning to live with such knowledge. Social support plays a huge role in the health of those infected with HIV by helping the individual cope with poor health, buffer against the effects of depression, and prevent isolation, loneliness, and suicidal ideation. Being diagnosed with a chronic disease like HIV can affect the numerous identities that each individual has. For example, an HIV or AIDS diagnosis can affect a person's work identity by causing their motivation and job performance to drastically decrease. Research has also shown that spirituality is a significant factor in the health of those living with HIV and AIDS. Many adults in the U.S. who showed an increase in spirituality after being diagnosed experienced lower disease progression, better psychological, social, and cognitive outcomes. Treatment advances, especially combination antiretroviral therapy, has greatly increased survival rates, with an estimated number of at least 3 million years of life that have been saved in the U.S. as a direct result of care. Though there are currently no cures for HIV, scientists worldwide are making progress toward the goal of developing a preventative HIV vaccine that is safe, effective, affordable, and available for worldwide distribution.